messaging me on Teams.
All right, yeah, he's got too many chats going. Okay, I'm letting everybody in. So, Kat, can you just give it about 10 seconds and then just get right into it?
Can do.
All right, admitting all now.
Good afternoon, bon après-midi à tous. Thank you for joining us for today's media availability on the novel coronavirus COVID-19. Merci de vous joindre à ce point de presse au sujet du nouveau coronavirus COVID-19. Before we begin, I'd like to go over a few items. A reminder to please place your microphone on mute until I invite you to speak and ask your question. To view who is speaking, To view who is speaking on Zoom, please put your view on speaker instead of gallery view. The button is located on the top right of your screen on the Zoom screen. Merci de bien vouloir désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Veuillez changer aussi votre écran au mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Le bouton est situé en haut à la droite de la portion vidéo de l'écran. Reporters with accessibility needs can pin the interpreters or follow along on the YouTube stream. Les journalistes ayant des besoins en matière d'accessibilité peuvent avoir recours aux interprètes ou suivre la diffusion en direct sur YouTube. Today, we will be hearing remarks from Dr. Brent Malachny, Associate Medical Officer of Health. Notre porte-parole aujourd'hui est le Dr. Brent Malachny, médecin-chef adjoint en santé publique. Nous avons aussi la présence de Andrew Hendricks, directeur de la protection de la santé et commandant de l'incident de la COVID-19 pour répondre aux questions en français. Following the remarks, we will then take questions from the media. Je passe maintenant la parole au Dr. Malachny. Please go ahead, Dr. Malachny.
Great, thank you, and hello, bonjour, quoi. It's been nearly 3 weeks since Ottawa entered stage 3. More businesses have opened their doors and more people have gone back to work. We continue to monitor the daily COVID-19 dashboard indicators closely to evaluate where we are and how we are managing the situation in Ottawa. With respect to reopening schools, last week the province announced its plan to reopen schools in September, and Ottawa Public Health continues to hear feedback from parents, school staff, and teachers about the plan to get our children back to school as safely as possible here in Ottawa. It's understandable that there are concerns with reopening schools, and it's important for there to be a dialogue between everyone involved: school boards, school staff, families, and children. We have to balance the risk of COVID-19 transmission with mitigating other harms to the well-being of children, youth, families, and school staff. Nous devons trouver un équilibre entre le risque de transmission de la COVID-19 et d'autres conséquences sur la santé des enfants, des jeunes, des familles, et du personnel des écoles. Ottawa children and youth have not been physically present in a school setting since early March, and we know that this has been stressful for many within our community. We are having ongoing conversations with our school board and provincial partners to allow for as safe a return as possible. We are planning for a variety of scenarios, including if an individual has symptoms, if an individual tests positive for COVID-19, and if there's an outbreak. Enabling a return to school this September that is as safe as possible is crucial not only for childhood development and academic achievement, but for the health and well-being of the entire community. Le retour à l'école est important non seulement pour les enfants, mais aussi pour le bien-être de la communauté. Everyone has a part to play. The fewer the number of people infected in the community, the fewer the opportunities for the virus to be introduced into schools. According to the latest data on our daily dashboard, the vast majority of people are wearing masks, 97% most of the time or always when indoors, and are practicing physical distancing, 91%. Thank you to those who continue to do their part. Unfortunately, over the long weekend, we observed instances of large crowds gathering in outdoor public spaces while not physically distancing or wearing masks. Certainly understand it's hard. This virus has been with us for the past 5 months, and many of us just want to get out and enjoy socializing with friends. But I can't stress enough that we must be wise about how we socialize. We've seen what happens in other areas that have let their guard down. Cases have risen sharply, healthcare systems have become overwhelmed, and they're unable to meet testing and contact tracing demand. Il est très important de rester avisé lors d'interactions sociales. Il ne faut pas baisser la garde. Nous avons vu ce qui peut arriver dans d'autres endroits. We can still visit with our friends and loved ones, but we have to do so in a way that reduces the risk for transmission. Remember, people can be infectious without any symptoms. So to protect yourself and others, this means wearing a mask, even when outdoors, if you can't physically distance. It means limiting the number of people you have in your backyard or at the cottage. You need to plan how you will maintain distancing among households and their social circles. Maintaining physical distancing means avoiding handshakes and hugs. Always have your mask and hand sanitizer with you and consider them as valuable as your wallet and cell phone. If you're uncomfortable in any scenario, leave. And if you're sick, please stay home and seek testing. We can still be social. We just have to do things differently. Be COVID wise and assess the risk of your activities. Now, as you know, last week, the federal government launched the COVID Alert app, a joint initiative with the province of Ontario that will help alert Ontarians of potential exposure to COVID-19. The app uses Bluetooth to exchange random codes with nearby phones. Every day, it checks a list of random codes from people who tell the app they tested positive. And if you've been near one of those codes in the past 14 days, you'll get a notification. COVID Alert also provides access to the most up-to-date public health advice and resources to anyone who receives a message that they've been exposed to the virus, including recommended actions such as getting tested, self-isolating, or monitoring for symptoms. While voluntary, I encourage everyone to download the free app. J'encourage tout le monde de télécharger l'appli Alert COVID. The more people who use the app, the more effective it will be in helping to stop the spread. For more information on the app, visit canada.ca. Thank you. Merci, Miigwech.
Thank you, Dr. Malopny. In the interest of time, I will quickly read through the list of media that we have registered for today. You don't need to indicate you are present. However, if I missed an outlet, please speak up after I am through the list. Pour gagner du temps, je vais lire la liste des médias qui se sont inscrits aujourd'hui. Vous n'avez pas besoin d'indiquer si vous êtes présent, mais me le mentionner si votre organisme est manquant. We have 1310 News, 104.7 Outaouais, CBC, CTV Ottawa, Global News, Le Droit, On the City from the Burbs, Ottawa Citizen, Ottawa Sun, Radio-Canada, TVA Gatineau Ottawa, and Your Community Voice. Have I missed an agency? Est-ce que j'ai manqué de quelqu'un? I see no comments, so we will proceed. I will now invite each agency in reverse alphabetical order to ask their question. Please remember you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique inversé. Chacun pourra poser une question et une question de suivi. So we'll start now with Your Community Voice. The floor is yours. Your Community Voice, are you here today? We will move on to the next one. À la prochaine, nous passons maintenant à TVA Gatineau Ottawa. Vous pouvez prendre la parole. TVA Gatineau Ottawa. Est-ce que vous êtes présent? OK. La prochaine, Radio-Canada. Vous avez la parole.
Oui, bonjour, Rosalie Sinclair pour Radio-Canada. J'aimerais savoir quelle est la moyenne de temps d'attente pour obtenir un résultat au test de dépistage, peu importe qu'il soit positif ou négatif, et aussi vous entendre là, sur l'importance d'obtenir les résultats rapidement après un test parce que les gens doivent quand même s'ajuster pendant l'attente, notamment au niveau de leur emploi.
Merci pour votre question. My apologies. Is it possible for you to repeat the question in English?
Yes. I would like to know what is the average wait time for getting a COVID-19 test result, positive or negative? And also if you had any comments on the importance of getting quick results after a COVID-19 test, because people who are standby still need an adjustment in their daily lives, especially in their jobs.
Okay, no, thank you for that. So typically the wait time after you've been swabbed or after you've been tested, that the results typically are within 24 to 48 hours. It depends a little bit upon what sort of group you're in. There is a priority given to those that we really want to have results back the quickest possible. So those would be also the groups that we want tested on a priority basis. That includes people with symptoms. It also includes people who are a close contact of a known case. Also to help our healthcare system, individuals who are a healthcare worker or a family member of a healthcare worker. So they will tend to have their results back quicker, closer to 24 hours. Other individuals, depending on their situation, will be closer to 48 hours. I think that, I'm sorry, was there another aspect of your question?
Yeah, I would just like to know if you have any comments on the importance of getting quick results after a COVID-19 test, because the people have to adjust their daily lives because of the wait.
Right, and so at this point, 24 to 36 hours is good. It would be nice to have better technology that was quicker. There are quicker tests that are being investigated. The problem is that there's trade-offs in terms of the confidence in the results, which of course in the end run isn't that helpful. And those products are being investigated, researched, but they're not, as far as I know, licensed here in Canada. The reality is that if one is part of a priority group, so for example, if you have symptoms, well, you should be self-isolating anyways, regardless. And certainly from a public health perspective, we would like to get the results back quickly to know whether or not the person has COVID, so that we can then take action to find out about contacts and make sure that they are protected. Similarly, close contacts, if you're a close contact of a case, you're going to need to be in self-isolation for 14 days. So again, the result is important to help understand what the situation is. But if you're a close contact, regardless of the result, you're going to be in isolation. So I suspect that you maybe think of some other scenarios where you might be waiting for the result to do something else. But for the groups that we're most interested in that have real public health priority in terms of identifying and taking control efforts, the results are back within around 24 or so hours. And those individuals are in self-isolation regardless.
Merci beaucoup.
Nous avons Andrew Hendricks aussi pour répéter la réponse, quelques réponses en français pour les médias.
Ce serait apprécié si ça peut être en français, s'il vous plaît.
Oui, merci. Bonne journée tout le monde. Je vais essayer de résumer qu'est-ce que Dr. Molokny vient juste de nous dire en anglais. La première question, c'était une question de la moyenne de temps pour recevoir les résultats pour des dépistages de COVID-19. Puis la moyenne, c'est entre 24 à 48 heures. Puis ça dépend de la raison dont vous présentez pour le dépistage. Les hôpitaux qui sont en charge de le dépistage, les laboratoires, ils vont prioriser des personnes qui ont des symptômes ou des personnes qui travaillent dans le domaine de santé ou des personnes qui sont des contacts proches des cas de COVID-19. Et c'est des personnes dont on va recevoir les résultats un peu plus proches du 24 heures au lieu du 48 heures. La deuxième question, c'était à propos de l'importance de recevoir des résultats de façon accélérée ou de façon vite. Puis absolument, on est d'accord que le monde veut avoir les résultats le plus vite possible. Souvent, les raisons dont quelqu'un va chercher pour des dépistages, c'est s'ils ont des symptômes, ils sont obligés quand même de rester chez eux en isolation. La même chose pour des contacts d'un cas. Alors, ils devraient rester à la maison pendant qu'il attend pour des tests. Nous savons que le système de santé puis les laboratoires, ils travaillent toujours de trouver d'autres technologies pour avoir des résultats plus rapides ou même avoir différentes sortes de tests. Mais nous savons que il y a des avantages puis des désavantages de certains tests. Puis on travaille toujours avec nos partenaires pour voir si d'autres dépistages sont disponibles pour le système. Merci.
Radio-Canada, avez-vous une question de suivi?
Non, ça va, merci beaucoup.
We will now move on to Ottawa Sun. The floor is yours.
Thanks. I'm wondering, it's been almost 3 weeks, as you mentioned, since Ottawa moved into stage 3. Can you kind of give a big picture? How are we doing with those stage 3 reopenings? Have many cases have you been able to link to the stage 3 reopenings? Just a sense for where we're at.
Yes, no, thank you. And I would say that, there's been two things occurring here. So we've had, as you've indicated in your question, the opening of various venues in stage 3. And at the same time, we've had, an increase in cases over a period of a few weeks. Last week, it was a decrease. It was about a 40% decrease from the preceding week. Back in the week of July 20th, I think we had about 195 cases over the course of the week. The subsequent week, we were down to 113. And so the timing isn't really related to the opening. I think we've said before that it would take probably about 2 weeks at least to be able to detect a change. So we don't really see a clear link there, nor are we in our conversations with cases, because of course all of the cases that are that come back with a positive test, we talk to them and try and understand where they might have been exposed, and we're not sort of seeing any patterns with stage 3. What we are seeing is that for the most part, there have been an increase in the number of cases in all age groups, but it's been a greatest increase in younger adults and teenagers. And certainly early on in 2-3 weeks ago, many of the cases were related to social gatherings. So that's the importance of socializing safely.
Did you have a follow-up question, Taylor?
Yes, thanks. I'm also wondering, what are the most common misconceptions about COVID-19 or about the public health guidance that you're hearing or seeing in the community that you think might be worth clarifying?
So one of the issues is around testing. I think testing has a really important role as a component of our response. It gives us information about trends. Are they going up? Are they going down? Who's becoming infected? That sort of thing. It also gives us the information to follow up with the cases and their contacts to prevent further spread. But in talking to our colleagues who run the testing centers, they have been observing that there's some individuals that are using the test in ways that are less than ideal. So one example is, individuals who are concerned about an exposure, and they come immediately, because they're worried, understandably, and come immediately for testing. And unfortunately for them, the test that day isn't going to give them an answer, because there hasn't been enough time, if they become infected, for the virus to progress and be detectable in the back of the throat, because that's what the throat swab is about, or the nasal swab, is to detect sufficient virus to say that they're positive, and that takes a number of days. And so our messaging over the last few days is to been saying, listen, if you're concerned, if you're worried, for sure get tested, but really should be about 5 days after you've been exposed. The other piece is the sort of false reassurance, perhaps, of a negative test. Testing is most useful when we're investigating people with symptoms, people who are contacts of a case. That's where it's most useful. There are situations where people are wanting to be reassured. It might be that they're starting a new job, or they're going to a gathering or with a loved one, and want that reassurance of a negative test. The challenge is that the result only gives you an answer for the day that you were tested as to whether there was sufficient virus in the back of your throat that day. You could still be infected. You could have been infected a couple of days prior to that and incubating, and are going to become infectious to others. But at the moment that test was done, you weren't far enough along in your illness, and therefore you're falsely reassured of a negative test. Similarly, if you get exposed after you have that test, again, the test is going to come back negative. But in fact, perhaps by the time you go to your gathering or visit with someone, you actually are infectious. So I think that some of these nuances of testing are things that people need to realize in terms of what a positive or a negative test means. And the last thing I will say is that I think when the Ontario government, as we moved into stage 3, expanded the size of gatherings for both indoor and outdoor settings, I think the piece of physical distancing and masking sort of wasn't quite loud and as clear, because I think some people proceeded to have their gatherings. And that's where we saw some of the transmission and even some of our conversations. People went, "Oh, really? You mean we actually had to distance as well?" And so I think that's also been part of our messaging, saying, yes, you can have gatherings. And yes, there's larger limits that the province has given. But physical distancing is still part of that. And, for a lot of venues, say your own home or your backyard or your cottage, 50 people is a lot of people to have in a space and have distancing between. So I think those are 3 areas that, where there's still some misunderstanding and wanting to clarify.
Thanks.
Thank you, Dr. Malakny. We're now moving on to the Ottawa Citizen. The Ottawa Citizen, the floor is yours.
Hi, can you hear me?
Yep.
So my question, Dr. Malakny, you mentioned this in your preamble, are about protocols for possible outbreaks in schools. Can you tell me when these protocols will be released? What infrastructure schools already have in place, and what infrastructures will need to be in place in order to deal with possible outbreaks?
Yeah, no, thank you. So I think as you know, the province released their school reopening plan relatively recently. And that was, I think, an important foundation upon which to say, okay, if that's how this is going to work, then what do we need to do? And so there's been conversations locally between Ottawa Public Health and the local school boards, but we're also having a conversation on a province-wide basis, and province-wide guidance is being drafted, and they're seeking input from school boards and from public health units such as ourselves around these issues. In some ways, I think the experience that we have with childcare settings, with day camps, provide experience in terms of having cohorts or limited groups of young people who are sort of interacting with each other but not interacting with other groups, and how to sort of investigate and manage. So I think that the type of investigation and follow-up that we'll be doing in a school setting will be quite similar. And so that's, we view this as our responsibility in Ottawa Public Health, that if a student or if a staff member at a school tests positive for COVID, that it would be notified to us, and we would do an investigation to identify who are the closest contacts. My read of the school reopening plan by the province is that the children will be in cohorts. So there'll be a classroom cohort, and if they're on a school bus, there's a school cohort, etc. So that will help us be able to identify, well, which children potentially could be exposed, and therefore we need to look at more closely to prevent further transmission. So I don't have an exact date for you when this material will be released. It's being actively worked on now, and certainly will be in place before schools open.
Is there a follow-up question?
Yes, there is. Can you tell me, there was a release today about a day camp at Foster Farm. So the reaction, if there is a positive case in a school, would be quite similar as to what we heard in that scenario. Is that what you're saying?
Well, I mean, I think you've got different scenarios and you've got different sizes of schools. And so, for example, um, in a day camp or a daycare where there might only be one cohort or a limited number of cohorts, then perhaps that facility will close or close temporarily to understand, what's going on and what is there risk from spread from one cohort to another. I think with schools, depending on the size and depending on the context, I think that there will be discretion in terms of if one has one case in one classroom, what does that mean for all the rest of the school? So think of a high school with maybe 1,500 or 2,000 students. You may not need to go to close the entire facility if you think the risk is limited to one cohort or two cohorts. So I think there's going to be a little bit of discretion, and frankly, those are some of the conversations we're having with school directors and with colleagues in other public health units in terms of how we're going to do this. So I think that there will be some flexibility and discretion on the context and the risk, but the general principles will be the same in terms of being most concerned with the cohort that the child or the staff member is in, and we would view those likely at highest risk, and those would be likely in self-isolation. And then the issue becomes, what is our risk assessment for potential exposure beyond that cohort, and to act accordingly.
Thank you.
We're moving on next to On the City from the Burbs. Sue Sharing, the floor is yours.
Thanks very much. I'm wondering what the city's policy is in terms of, you spoke about, the parties of young people. How is the city treating this? And have you been levying fines and charging people?
So that aspect of enforcing the size of gatherings, of deciding whether to provide education or whether you're at a point of wishing to issue a ticket or a fine, that is the responsibility of bylaw services. And so they've been, the lead on dealing with situations, whether it's been in parks or beaches or other outdoor settings. So they would be best people to talk to about this enforcement aspect. One of the challenges for the sorts of social gatherings in numbers that we saw, a few weeks ago is, well, one, they weren't necessarily within our jurisdiction. I mean, when you think of cottages, they aren't necessarily within the city of Ottawa. So that would be in someone else's jurisdiction. But it's also difficult to know whether people are in the same household. The numbers now that with 50 is for indoors, 100 is for outdoors, and so you can easily have social gatherings. And actually, many of the social gatherings that we're aware of that led to transmission would fall within those limits. And so actually, bylaw wouldn't apply because they are actually not violating the size of the gatherings. It sort of goes to the point is just because it's allowed doesn't necessarily mean it's a good idea, because it goes back to, the size of the venue. Like some of those recommendations for maximum numbers of people, those are often for commercial properties, frankly, for a banquet hall or a theater or that sort of thing, which is very different than your cottage or your or your own home. So it comes more down to the host in planning the get together in a manner that is as safe as possible. This is where it comes down to our responsibility to do that, to plan it ideally outside, to plan it in a way that there's not too many people so that you can maintain distancing, physical distancing between people that are not in the same household or social circle. And then to be thinking through, so how will we do refreshments? How will we have access to the washroom, etc., in a way that allows you to socialize as safely as possible, but to not have an increased risk of transmission?
I just need a follow-up on this question because I don't really, I would like a more fulsome answer. I would presume that you and bylaw work together. And you started off this news conference by saying, you know, the problem has been these social gatherings of young people. So surely you're trying to, I mean, isn't it time to, you know, bring the hammer and shut this stuff down?
So, so I think there's at least a couple of aspects. So first off, I think it's better for people to understand that there's a risk, that what they're doing can potentially infect their friends and others, because I don't think there was necessarily a full appreciation of the risk of having gatherings, particularly indoor gatherings. And if you recall, I mean, there was at that time not a lot of cases that were occurring in Ottawa. So I think people may, felt a little bit overly confident that COVID wasn't around as much as it was, and that they could go back to normal with the nice summer weather. So there's that piece, and so I think it's better for people to understand than to rely on enforcement. But my other point is that with the provincial guidelines for maximum size, so for example, 50 people, I would say, from what my memory is, that most, if not all, of the gatherings would have actually fallen within the provincial numbers, and so there would not have been the opportunity for bylaw to intervene, because the sizes were under the provincial limits. The challenge is that there wasn't a sufficient distancing or mask use, or people came who had symptoms, which comes down to really, the individuals who are there, and ultimately comes down to all of us to navigate our lives living with COVID in a way that reduces the risk of transmission.
Okay, I know this is my second question, but I do find this whole response a bit frustrating, and I'm certainly not blaming you. I understand the limitations that you're dealing with, but for someone like me who's over 60, who's following all the rules, I'm frustrated that we're not taking a bigger or a hammer at all. I mean, I get that the rules say 50, but they still also say social distancing and masks. So you've got, I would think you have to come up with a way to convince me to stay away from people while other young people are seemingly doing what they want. And I don't understand the no repercussions part. So maybe
Thank you, Sue. We're gonna have to move on, unfortunately, to another agency.
question.
We've heard two questions already. Thank you very much, Sue. La prochaine question viendra de Le Droit. Vous avez à vous la parole.
Oui, bonjour. Je vais répéter ma question en anglais si c'est nécessaire. Dr. Malakny, il y a un petit peu plus de 3 semaines, vous nous avez lancé un peu, si on peut dire, un wake-up call après que le nombre de cas ait augmenté de façon significative à Ottawa, notamment en raison de rassemblements un petit peu trop sans distanciation physique. Est-ce qu'on peut déduire de la réduction du nombre de cas depuis que le message a été bien entendu, ou on a encore beaucoup de nouveaux cas qui proviennent de rassemblements?
Okay, thank you, Julian. I'll paraphrase, and please correct me if I haven't fully understood. And so really that, we sort of made a call, a few weeks ago saying, listen, we're concerned with the increased number of cases, and how are we feeling, or how satisfied are we with what we're seeing today? Is that the general gist of your question, Julian?
Yeah, like, I don't know if you use the word wake-up call or something like that to qualify the rise in new cases, but do you think that this call has been heard and people are more careful since then?
Yeah, no, thank you. So I think we have some reason for optimism here. Like, it's still early to be able to say for sure, but we did have those 2 weeks, week after week, and then another week after week, where we doubled our weekly cases. And it was at that point we, certainly were expressing, our concern to the public that, listen, COVID's back and we need to learn from this. So I think it's positive that our numbers last week have come down from the preceding week. So that's 2 weeks after the first week of elevation. And so I think we have to continue on. The challenge, of course, was with the cases, we're always seeing what happened 2 weeks ago. So, what we can do action-wise is every day from here on, trying to prevent transmission as we live with COVID. It will be also important to see over this coming week and next week, do the numbers stay down? Can we push them down even further, which would be ideal? But we are having more interactions. Things are open. So I think that there's those increased opportunities for transmission. So ideally, what we don't want to see is cases going back up again. We'd like them to stay level and ideally to be decreasing. But I think the fact that last week the numbers came down from the preceding week is a positive, and hopefully that occurs again this week. And really, it's up to us. It's in terms of all of us, in terms of what we do to reduce transmission by not going out to work or being around others when we're sick, keeping our distancing, wearing a mask, and washing your hands. Those things which we know can prevent transmission.
Est-ce que vous avez une question de suivi, Julien?
Oui. Est-ce que c'est possible d'entendre?
Oui, alors je vais demander à Andrew Hendricks de répéter les messages clés.
Oui, merci Julien. Juste pour résumer ce que Dr. Malakny a dit, c'est concernant je pense que tu utilisais le mot, le wake-up call de plusieurs semaines passées. Il y a des raisons pour être optimiste avec la dernière semaine, excuse. On a vu des cas plusieurs semaines passées, puis dans la dernière semaine, on a vu une réduction dans le montant de cas. Fait que ça, c'est bien à voir. On est content avec ça. Mais il faut toujours savoir et réaliser qu'il y a des opportunités dans la communauté pour avoir de la transmission de COVID-19. Avec phase 3, il y a de plus en plus chaud d'employeurs qui ouvrent d'opportunités dans la communauté pour avoir la transmission. Fait que nous voulons continuer à essayer de réduire le montant de cas. C'est un besoin qu'on a tout besoin de supporter les messages clés en termes de porter un masque, de maintenir la distanciation physique, de laver les mains et surtout de rester à la maison si vous avez des symptômes. Et il faut continuer à observer les numéros, les chiffres, le montant de cas, pour faire sûr que nos démarches y fonctionnent. Merci.
Merci beaucoup. Ma deuxième question, en fait, c'est après la découverte d'un cas dans un camp de jour de la ville, est-ce que cette situation-là nous amène à revoir un peu notre approche dans l'ensemble des camps de jour adaptés qu'on a cet été à Ottawa?
My apologies, Julian. I did not quite follow that. Could you paraphrase that in English, please?
Yeah, for the childcare where we saw the day camps actually, sorry, where we saw a case of COVID-19 been declared, I think, on Saturday. Is there anything that we learned from that should change the way we approach things in all the day camps across the city?
Okay, yeah, no, thank you. So I think the reality is that when we have COVID being transmitted in the community, and the more there is, the more opportunity that, say someone who works in a daycare or works at a day camp will become positive. And so I think we've seen that with some of our daycares, and that I think it's just going to occur, and we treat it quite seriously. We view one case in a day camp or a childcare facility as an outbreak, and to prevent any further transmission in that. And so I think it just means being vigilant to make sure we continue to screen staff and children who are participating every day to make sure that there's no one there with symptoms. And that when someone tests positive for COVID, which is not unexpected at some point, that we respond, we investigate, and we control any further transmission, and we identify anyone who is a close contact so that they can self-isolate and test them as needed to prevent further transmission. So I think it's just the reality of living with COVID and opening up. I think that when we planned for day camps before the summer, and when we planned for childcare facilities to open up, that it was likely that we would have cases in such a instance. And now we do, and we've acted accordingly to prevent further transmission.
Je vais passer aussi la parole à Andrew pour les messages clés en français.
Oui, je vais essayer de résumer encore une fois. Fait que nous, on était très connaissants de le fait qu'avec le COVID-19 dans notre communauté, qu'il y avait des chances d'avoir des employés qui travaillent dans ces situations-là, de peut-être amener le COVID-19 dans les garderies et le camp. Fait que c'est quelque chose qu'on prend très sérieux. Puis le minute qu'on découvre qu'il y a un cas dans un camp, pour nous, c'est une éclosion, même si c'est juste un cas. Puis on prend plusieurs démarches pour protéger les employés qui travaillent là, puis aussi les enfants qui sont dans le camp et dans la garderie, pour faire sûr que les personnes qui ont été en contact de très proches, qu'ils restent en isolation, et s'il y a le besoin de faire des dépistages, de faire des dépistages nécessaires. C'est un exemple c'est la réalité de vivre avec le COVID-19 dans notre communauté, pour faire sûr qu'il y a des places comme des camps pour les enfants et pour les familles qui ont besoin de ces supports-là. Puis, il faut continuer à travailler dans ces situations-là et d'apprendre de ces situations-là. Merci.
Merci, Julien. Alors, next up, we have Global News. Global News, the floor is yours.
Thank you. Dr. Malakny, on Monday and Tuesday, we saw some very low COVID-19 figures in Ottawa, but just wondering how much stock do you put in those two daily reports specifically, given that we had reduced testing capacity at centers in Ottawa over the long weekend?
Yeah, no, thank you, Craig. I mean, overall, I don't overreact to a couple of days of data one way or the other, whether it's low or a little high, because it can fluctuate. It's really the trend that is most important. In addition, I think you're right. I think that one can hypothesize that with the long weekend that people may have not been coming out as much for testing. There was also not as many venues open. So I think that I wouldn't read too much into those low numbers, and it quite possibly could be just to reduce testing. But I think we want to look at the sort of the longer term in terms of week over week in terms of what is showing, and I described that earlier in terms of we had a couple of weeks in a row where we were seeing quite large increases. Last week, a reduction from the preceding week, and we'll see what this week shows and next week shows, and sort of watch the trends And again, we're seeing results that occurred, or infections that occurred a couple of weeks ago. So that's always the challenge in this work. But really, it's what we can do now, all of us, in terms of preventing transmission in our daily lives.
And still staying on the testing topic, you were talking about people being a little unsure of when they should get tested. Waiting 5 days before it's likely to actually manifest in a throat swab. There, when people are presenting for testing, is there any kind of screening in place where people are asking, why are you here? Is there any attempt to filter out people who might want to wait longer for a test, or is it, once they're there, best to process them, that kind of thing?
So I think there's a few pieces here. I think that and what we've been trying to do this week is provide a little bit more context to explain a little bit more about the nuances of testing. Also in response to what our colleagues in the testing centers are saying and they're seeing. I was speaking with one of the physicians yesterday, saying, yeah, he has to sort of talk to these people who have come in for testing and say, I can test you, but it's just not going to be that helpful. And that if you really want to know the answer as to whether your exposure yesterday, you may have gotten infected, you need to come back. So I mean, the operations and how the testing centers are designed, I mean, that's up to the test sites who operate those, which is run out of the Champlain Health Region and the local hospitals. But I think it's helpful for the public to know in terms of, if you have certain questions or if you're trying to achieve certain things through testing, like I'm concerned about a particular exposure, or I'd like to protect others, to realize there's some nuances involved in this.
Great, appreciate the answers.
I guess the other thing I would like to add is, of course, don't by any means want to discourage people with symptoms or people who are close contacts of a case. Absolutely, we want them to be tested. And we were happy that, the test centers were still open over the weekend so that people who wanted to get tested could still get tested.
For sure, thanks.
Thank you, Craig. Next up is CTV News. CTV News, the floor is yours.
Hi there, Jeremy Sharon here from CTV News. My first question is in regards to comments we heard from Premier Doug Ford yesterday in saying that this idea of keeping your social bubble to 10 people is here to stay, he says, until about 2021. I'm wondering what your reaction is to that, and are people in Ottawa following those rules, or do they need a reminder of that specific part of the guidelines set out by the province?
Yeah, no, the social circle piece, I think, is something that we will need to continue to reinforce with folks, because I think there's the opportunity for misunderstanding. So just in, briefly, the idea of the social circle was to be able to extend beyond our household, the number of people that we could interact as though they were members of our household, that we don't physically distance with, that we don't wear a mask with, and was really intended as for the social supports. Because let's face it, when we were all locked down and restricted to our homes, for the most part, was very challenging for many of us. So the idea of a social circle was to be able to extend. The issue, though, is that there is a reciprocity, that there's an agreement amongst all the people in a particular circle that they are only going to treat each other in that way, of those in a circle. Like, you can't belong to more than one circle. So, for example, if you're a family of 5 and you live next door to another family of 5, and you say, hey, we're going to come together, and our group of 10 is, we're going to socialize, the kids are going to play together, the adults are going to socialize, and we're going to treat each other as though we're all part of the same household. And we're going to physically distance with everybody else outside our 10. That's the key part for this to work, is that regardless of how you configure your 10, it's your household plus the other people who are agreeing with each other that they're going to not socially interact without distancing with everybody else. So that's the challenging piece. And I think that's the piece that we need to reinforce, that it's not, I'm part of this bubble today, and then tomorrow I'm part of another bubble, and then et cetera, because then the 10 becomes 20, becomes 30, becomes 40, and just becomes an opportunity for increased transmission. In terms of Premier Ford's comment about not expanding, to be honest with you, from a public health perspective, our advice is keep your circle as small as possible. 10 is the max, but doesn't mean you need 10. If you can get by with 4 or 5, like say you're a person who lives on their own, or maybe with a roommate, and you know, 2 or 3 other people who will agree with you to be part of each other's circles, that may be fine, and that's wonderful, because the more we can restrict the number of close contacts that we have, because remember, it's distancing and masking that's going to protect us, and the people in our circle we're not doing that with. So the more that we can limit the numbers, the better.
Thank you. So I guess a bit of a follow-up to that, and another part for my second question here. Would you say that so far people in Ottawa are following those rules? If so, how important is it that they continue to do so moving forward? And in connection to that, at the end of July, we saw a lot of cases being linked to social gatherings. You've spoken a little bit about it here. And so obviously, if people are doing that, they likely are not following that rule. Are you still seeing that? Are you still linking cases to parties, people who aren't breaking those rules? And how crucial is it that this social circles thing is really hammered home for people? And should they expect to continue to do this for a long time?
Okay, so thanks, Jeremy. There was
Sorry.
a lot there.
Yeah.
Lot there. So let me do my best to try and cover those off. So look, I mean, we are going to be in this for a while. You know, COVID has the ability to transmit if you give it the opportunity. So we've learned that here. But I mean, if you look at other jurisdictions, they're learning a much tougher lesson about its ability to spread if you give it the opportunity. So we have that piece. Plus, we have the situation where the vast majority of us are susceptible. I mean, we had you know, estimated that from the case numbers, but we have the seroprevalence information that's coming out from both Canadian Blood Services as well as provincial studies, that, you know, it's in the 1.5% range, which is what we thought. So that means the vast majority of us, like the 99% of us, are still susceptible. So we have to be cautious. We have to socialize wisely and be COVID wise. So the circles, I think, are important. It's a balancing act, because in some ways, if we just stayed with our households, then we would reduce our risk. But we're social beings, and it seems reasonable that we have people beyond our household that we can socialize with, but to do so in as safe a manner as possible. And that's the part of having that commitment to each other, that listen, we're not going to distance with each other, but outside our circle, we are going to distance and protect all of us in the circle. So we're going to need to do this for a while. And as you indicated, clearly a few weeks ago, we went way past that, where we didn't have any sort of distancing at some get-togethers, and we saw the impacts of that. Now, the good news is lately we haven't seen any of those larger gatherings. But of course, it's not just large gatherings that's a risk. I mean, there are particular risks from a super spreader perspective, where you have one person show up at the gathering who's infected, and 6 or 8 or 10 leave infected. So that really increases your numbers very, very quickly. But this can also happen on a smaller scale. So, you know, if, you know, I've heard anecdotally, you know, a workplace, they distance in their workplace setting, but then they would go out and all sit around a patio table, for example, where they cannot distance. And so, or have a get together in someone's backyard without distancing, or within their home, where the place doesn't matter. But the point is that as soon as you take individuals who are not committed to keep each other protected in a circle, who will socialize together, that provides the opportunity to for transmission. And so I think those are the sorts of situations that still occur, are still providing an opportunity for transmission. And that's why people need to continue to maintain their distancing, use a mask, don't go out if they're sick, and really only drop those protections in terms of distancing and mask use for people in their household and the limited number of social contacts who have mutually agreed to keep each other protected.
Thank you.
We're moving on next to CBC News. CBC, the floor is yours.
Hi there, it's Kate Porter here. Dr. Malakny, I'm listening to you. I also heard you say at the beginning you're hearing from a lot of concerned parents and teachers. And I wonder how to explain, because we've heard this said, that they don't quite understand how you can have to physical distance in your household, keep your bubble, and yet the scenario is that your 6-year-old will be in a classroom with possibly 25 other kids, each belonging to social bubbles of 10, and somehow that's still in accordance with all of what we've been taught for the last 6 months or so. So just how do you square, I guess, those two scenarios when you're ensuring people that school will be safe?
Right. So a couple of things come to mind, and I think that we're looking to make school as safe as possible. We're reopening schools while we have COVID, and so the question becomes how to design and weigh reopening schools in a way to make it as safe as possible and reduce the risk of transmission, because not reopening schools has harms associated with, both academically and socially, and from a childhood development perspective. And so, I mean, we don't run the school system. I mean, this is what, the Ministry of Education and school boards are needing to grapple with in terms of how to design 5-day-a-week schools, certainly for elementary school students. And so what we see is similar to what we had for childcare facilities, for day camps, in which you have a mix of achieving distancing, of mask use. Now, I recognize that for the age person that you gave, that mask use may not be feasible. And then the issue of cohorting to limit the number of contacts. It's really around a balance of how to reopen school while also reducing risk as much as possible, and then recognizing that, if a case occurs, to be able to identify that and then to respond to be able to prevent further transmission. So basically, it's a mix of distancing, masking, certainly from grade 4 upwards, as well as the use of cohorts to limit the number of potential exposures that could be occurring.
Okay, as a follow-up though, I guess in the case again of younger grades, you're not going to keep 6-year-olds a meter apart, right? The cohort is large and possibly group sizes of 25 and difficult to trace. So what feedback, when you say, guidelines are coming, what feedback are you giving the province about how to prevent COVID in these groups at schools? Or is it just an acceptance, like you said moments ago, for daycares and camps, that this will just happen? Like it's kind of a given that we'll get outbreaks. So if you send your kid to school, you should just accept that that's quite likely. Is there a prevention piece here, then feedback you can give to actually prevent this as parents are trying to make decisions? Or is it just sort of a message that we'll try to be safe, but we have to accept that this is going to happen?
It's a little bit of a few of those things. So let me try and pull this together. So yes, I think that there's things that can be done to reduce the risk of transmission in schools. So that includes, staff and students not coming to school if you have any symptoms. It includes limiting the number of contacts that a child has. It includes where tolerated the wearing of a mask. And so that you've got, a combination of people shouldn't be there if they're sick, that we have as much as possible distancing occurring. And certainly our experience in day camps, for example, was that through design of activities, the day camps tried as best as possible to have activities that would encourage the children to have more distance than they would have normally. In the older children to be wearing masks, and that there wouldn't be mixing of the children with all of the other children in the school, but rather to limit it to smaller groups or classrooms. So with that said, I mean, I think those will all contribute to making schools as safe as possible. But at the same time, we need to prepare for and plan for that. There may be cases in a city the size of Ottawa. I mean, there will be cases in schools, and we will have the processes in place to investigate and control transmission if and when that occurs.
Thanks.
We're moving on next to 1310 News. 1310 News, the floor is yours.
Hi, Dr. Malakny. Switching gears just a little bit here. Toronto, they've implemented their mandatory mask policy in all the condo and apartment buildings in those common areas. Some places here, they have implemented that, but it's not mandated by public health. Is that something that you're discussing or planning on recommending?
Yeah, no, it's certainly something that we've been looking at. When we did the mandatory mask bylaw, it didn't look at that point that it would be applicable to apartment buildings, condos, that sort of thing. And certainly we provided advice because we got a lot of questions from landlords and condo boards saying, well, what does this mean? And we said, listen, just because the bylaw doesn't apply to your setting doesn't mean it's not a good idea. So feel free to establish a policy. We're looking now in terms of how best to go further. Is it further, advice and guidance in terms of instructions or guidance to all of the landlords and condo boards to proceed, as well as looking at other mechanisms that would be able to cover this. But what we had learned from when we did the municipal bylaw for mandatory masking was that it wouldn't apply. So we started the communication then, but we are looking at other mechanisms at the moment.
Perfect. And some comments from Dr. Theresa Tam that we may be masked up for the next 2 to 3 years, even with a vaccine. Are residents in Ottawa prepared for that possibility, considering it's been only a few months and there have been some signs of slipping?
Yeah, I mean, even that seems like a long way away. I think let's just do one step at a time. We're in August 2020. We've schools reopening. We've had stage 3 reopening. We haven't seen any huge adverse impact yet of that. We did have an increase in cases. We've described what seems to be contributing to it. We all need to be sort of COVID wise to prevent transmission. And then, let's see. I mean, we don't even know which vaccine, when, how effective it is, all that other stuff, how long it'll take to give. So I think there's a lot of stuff to come in the upcoming months. And I don't think we should be, worried or spending time thinking about, well, what will it be like next year or the year after. I think we focus more short term as, how do we make sure we can socialize more safely? How do we support the reopening of schools as safe as possible? And learn from that experience, and then take the next step. So I think it's more baby steps at this point to, week by week, month by month, and work through this together.
Thank you.
Merci. Alors, la prochaine question viendra de 104.7 Outaouais. À vous la parole. Avons-nous quelqu'un de 104.7 Outaouais? Alors, je ne vois personne. That is all the time we have for here today. I'd like to thank you all for participating. Ceci conclut le point de presse aujourd'hui. Merci beaucoup et bon après-midi.
Thank you.